May is Skin Cancer Awareness Month, and this is particularly relevant because skin cancer is the #1 type of cancer of any type in the United States. It's more than breast, prostate, and colon cancers combined. 80% of skin cancers are on the head and neck, so you can often notice them early. And the earlier you find your skin cancer, the more treatable and curable it is. I'm going to talk today about 3 of the more well-known types of skin cancers and how you can spot them. By far, the most common is a basal cell carcinoma, which often comes up like a pearly bump that just never heals and over time may start to bleed. The second most common type of skin cancer is something called a squamous cell carcinoma, and that actually can come up like a scaly papule bump that just doesn't heal, can often be a sore. And with both of these skin cancers, thankfully, they are by far the most curable and treatable. Surgical excision is often completely curative, but if you catch them early, you can even use a topical chemotherapy, like a cream, or even a less invasive procedure. So the good news is the vast majority of skin cancers are completely curable if you catch them early, and they almost never affect your general health. On the other hand, melanoma, which many people have heard of, is very rare, but is also the most lethal and most dangerous type of skin cancer. And when we talk about melanoma, we use something called the ABCDs to help remember what to look for. And that stands for asymmetry, meaning if you were to fold it in half, it wouldn't look the same on either side. The B stands for border, so a blurry or irregular border. The C stands for variability of color, so light brown, dark brown, black, red, shades of different colors within the same spot can sometimes be dangerous. And then the D stands for diameter, which is often about the size of a pencil eraser, or 6 millimeters is what we use as our cutoff for something to be more concerned about. With melanoma, though it's much less common, it's much more lethal. And if you don't catch a melanoma early, it does have the potential to spread to lymph nodes or elsewhere in your body, and it can harm your general health. The good news is, in addition to surgery, there are a number of newer treatments for melanoma that are much more effective that have come to pass in the last 10 years. With skin cancer, the very best way to prevent it is to prevent sunburns. In fact, the number of blistering sunburns you have is directly related to your lifetime risk of skin cancer. In addition, we know that tanning beds with their concentrated ultraviolet light can dramatically increase your risk of skin cancer. What I tell my patients is, to prevent sunburns, you should really be looking at protecting your skin from harmful ultraviolet rays. And so we talk about using a sunscreen with an SPF 30 with zinc or titanium, which are mineral ingredients that deflect ultraviolet light. We talk about protective clothing like broad-rimmed hats and sunglasses just to shield your eyes. And then of course try to minimize, especially if you're at high risk, your outdoor activities between 10 a.m. and 2 p.m. when the UV index is highest. And if you're someone at high risk, please go in, have a once-a-year full-body head-to-toe check with a doctor, and don't blow off any spots that are there for more than 4 to 6 weeks, that bleed, or are sores that don't heal. Please have someone check it. I appreciate you listening to this. Don't forget to wear your sunscreen.